It'd be my pleasure. And first, I want to thank ASH for allowing us to present our work as an oral presentation. I presented our work on behalf of a total of 14 academic medical centers in the United States. Dr. Reem Karmali was our senior author and the orchestrator, had multiple oral abstracts and posters from this consortium, so I was lucky to lead one of them. But this was the first multi-center US cohort analysis of transformed follicular lymphoma compared to a matched de novo diffuse large B-cell lymphoma cohort. And we wanted to drill into recent signals that showed that transformed lymphomas do better with CAR T-cell therapies. And we wanted to look and see which subtype of indolent lymphoma may have the best outcome. And one of the signals we had seen previously was that transformed follicular lymphoma may have had a relatively greater benefit with CAR T-cell therapies. And our work showed that actually this year. We did a comprehensive retrospective study, and we looked at multiple clinical pathologic variables, treatment effects, looked at bendamustine exposures, prior treatments. These were all patients who had never received CAR T-cell therapy before, and of course were allowed to receive novel agents in later lines of therapy, which impacted their overall survival into the better compared to our 2015 Lymphoma Care Consortium findings. Long story short, transformed follicular lymphoma did markedly better with a statistically very significant overall survival benefit with CAR T-cell therapy. This was irregardless of the CAR T-cell product used. Some of them were on clinical trials, but they were balanced between the two cohorts. And there were no differences in our study for toxicities, steroid use. There was significant differences in bendamustine exposure in the transformed follicular cohort. And those folks who did get bendamustine pretreatment did worse, about a 10% decrement in overall survival at 3 years. And this is the largest study of its kind. There were other abstracts presented at ASH this year, including the one right before me in the oral presentations, that showed similar findings. So I think this is the year where we see transformed follicular lymphoma largely explains the relative benefit of CAR T-cell therapy and the differences in overall survival outcomes, the better outcomes in transformed lymphomas. They likely explain the majority of those findings. We will have data I've submitted to our tandem conferences in February. Poor me has to try to go to Honolulu, Hawaii to present that work. And just to let you know, we have some updates on some of the other histologies of transformed lymphoma that we'll be reporting on there as well.